This is the Get Real Clinic podcast with Dr. Masterson.
Welcome to the Get Real Clinic podcast. I'm really glad that you're here. Here's why we exist. We understand that in order to have really great outcomes, really great results, we've got to be able to get real in clinic. And the reason for that is because we deliver healthcare with other people. I've been in some great clinics. I've been in some awful situations at clinic, and it always has to do with the people that you're working with. And we have control over that. We have the ability to influence what our work culture is like. If we enjoy going to work, if we enjoy the people we work with, because we can affect the relationships with those people by actively engaging with those people. So on this podcast, we're going to focus on the cultural and the people dynamics as it relates to communication, workplace drama, things like scheduling and boundaries in order to have a really great clinical experience as it relates to human relationships. My name is Dr. Masterson, and I've been in lots of clinics for lots of years and now have been able to open several clinics, and I've learned a lot about what not to do. And I'm going to share the things that I've learned so that you don't make the same mistakes I did and you can have a great experience at work, because I want you to have great outcomes and I want you to get real in clinic. So on our first episode today, we're going to talk about what it means to have real communication in the office, in the clinic, with our staff members. The way this podcast is going to work, the same every week, is we're going to take a topic and then we're going to break it down into the two different lanes that it belongs into. One for the providers, surgeons, doctors, and one for the team members. So that each person that has a direct role in providing patient care or doing something in the clinic feels like it's specifically targeted to them. My hope is that each person in the clinic, one or two from each group, will watch this, digest it, and then it will lead to a conversation. Because conversations typically lead to relationships, and relationships lead to great workplace culture. All right, if you're a staff member, here's typically what it sounds like, or the painful things about communication breaking down. Number one, I hear things like, I didn't know that was my responsibility. I thought somebody else was doing that. Or, no one told me we changed that. We used to do it the other way, and now we're doing it this way. When did we change that? No one told me about that. Or, I thought that someone else handled that. Am I supposed to do that in order to? Because I typically, when that happens, that's not my role. Or, I didn't want to ask that question because then people would think I was dumb, right? Those are the typical red flags of poor communication in an office. So, what do we do about it? And as a staff member, obviously everybody wants to get better. If you're watching this, you clearly want to improve your dynamics in your workplace. So, tip of the cap to you, and thanks for being here. And here's what it looks like. 3 things to look for. There are things to aspire to as a team member at a medical office. Number 1 is that you're asking, or the team is asking, clarifying questions. What that means is if you don't understand something, you're just raising your hand and saying, hey, real quick, I have no idea what's going on. Honestly, no words are more beautiful to me at work than when somebody says, hey, real quick, can you please explain that again? Because then I know they actually care. They want to be there. Nothing sounds sweeter to your manager, to your doctor, to your surgeon if you just ask real quick, hey, can you please explain that again? Because they immediately know it. What we think a lot is they're going to think I'm dumb. No. They're going to think you're smart because you're like, you know what? I don't really understand this and I want to know better. I want to know more. Number 2, people take responsibility. When something goes wrong or something goes south, they're like, oh, shoot, that's on me. I should have done that, right? Because that communicates 2 things. I care about what happened. And number 2, I know that this performance or this thing I did is not defined who I am, right? I'm confident enough to say out loud, that was on me, because there's more value in my life than just doing that. And finally, people ask questions about what we're doing. Like, hey, real quick, can you remind me about what the goal here is, or what we want to do today, or what time we want to be done by, or how many patients are we trying to do in this amount of time? I'm just trying to get clarity on what we're doing. It's unbelievable. And how different our interpretation of what we're actually doing can be. So when does it break down? Really simple. 3 things you want you to remember is when we don't clearly understand what the person, the leader, the doctor, the surgeon is, or the practice manager is communicating to us. I typically, when I hey, I've got a new idea, or I want to implement a new system, or I want to buy a new piece of equipment, or I want to do something different, I've got all these great ideas. And I'm just coming in hot. And you as a team member are sitting there thinking to yourself, okay, that's great, but it seems like the way we're doing it is fine. I mean, nothing's broken. And here comes this doctor or this surgeon or this nurse practitioner, PA, whatever, pharmacist, PT, and says, hey, I'm going to change some things. I'm like, why do you want to change it when it's working? And so now we've got a little bit of conflict. We got a little bit of miscommunication because we don't have our values and goals aligned. And guess what? Red flag, I'll tell you the truth here. I don't always lead with why, right? I don't always come in and say, hey, like, this is why we're doing this. I just come and say, like, I'm so excited about the change, and here it is. And I'll give you a list of 15 different things I want to do by who knows what date. So in that moment, feel the freedom. So just ask them, so what do you want to do? Or why do you want to do it? Right? That's just going to allow me to repeat back to the person communicating to me, this is what I think you're trying to say. You'd be shocked that when you say that back to them, if they're like, no, that's not what I said at all. We're on different pages. The second thing I want you to do is start working on taking responsibility. And here's why that improves communication. If you're willing to take responsibility for something that you were taught, not taught, don't understand, that, like I said, communicates two really big things. Number one, I care. And number two, I want to get better. Right? If I say, yeah, shoot, that's on me. I should have done that better. What I'm communicating is that I'm okay with the person that's told me that I'm not doing that well and I want to get better. If you take personally some feedback that's given to you about not doing something right or when I missed the mark. For example, I can remember many times in residency or even jobs prior to medical school when I would do something that wasn't where I needed it to be. And I would take that personally. And what that does, number one, is it makes me believe less about myself, which isn't true. And number two, the person that's giving me feedback, some part of me, perspective that I don't ever usually even understand, it disincentivizes them to give me feedback in the future, right? So if somebody says, hey, like that wasn't the best, if I take that personally, that person's more likely to not give me feedback in the future. So what happens, that person doesn't say it the second time. They don't say it the third time. They don't say it the fourth time. And now we have this miscommunication whirlpool that's swirling around and around and around, getting worse and worse and worse, because by the time it becomes an issue that it has to be communicated, the person has really just kind of gone out of their way to not say anything. And so I'm going to take it even more personally, and they're going to avoid saying it even more, which that makes communication 10 times worse. And finally, really being intentional about asking or saying something we don't understand. Saying like, you know what, I don't remember how to do this, right? So it's different than clarity in the sense of, hey, I'm communicating something new and I want to understand what's going on. I'm talking about when a system potentially is off. I'll tell you a story. So one time at our clinic, we were implementing allergy shots, doing something again and again and again. And something was broken within the system. Something wasn't being done well. But the first person made the mistake and taught it to the second person. And then the second person made the mistake and taught it to the third person. And the third person made the mistake. And nobody ever felt enough safety or freedom to say, hey, why are we doing it this way? Or I don't understand why, because I'm pretty sure we're supposed to do this and not this. By the time someone asked that, it had gone on for 6 months, perpetuating the same mistake over and over and over. So get comfortable with saying, hey, I don't really understand why we're doing this. So 3 things to remember about trying to get on the same page as a team member with communication in the clinic. Number 1, make sure to say out loud what you think the person has communicated to you. Number 2, always try to take responsibility. Responsibility in the form of saying, hey, like, you know what, that's on me, I should have done that. Because you're communicating, I want to get better. And I understand that I've got a little bit to grow. And the person giving you that feedback is going to give you more feedback in the future. And then number 3, be okay with asking questions about an existing system or an existing process or a problem, because you would not believe how important you are about making sure to find the little things, problems in the system, because you're on the ground floor. You're on the front lines. You're the one that makes the difference in patient care. Is there something being done inappropriately or wrong or not in the best way? It's typically our frontline staff. They can figure that out. And if you want to have the best patient outcomes, don't be afraid to get real. Thanks for checking it out.